So, good morning, everyone. I am Jessie Whittish with Kentucky Youth Advocates, and it is great to see all of you here this morning as we talk about the National Kids Count data and Kentucky's data within that release from the Annie E. Casey Foundation. So just a reminder that we are recording today's forum to share as both a video and a podcast. So if you have any questions or comments or anything like that, please drop those into the chat and we will try and answer those. But we do ask that you stay muted, but we will get to your data and policy questions. So with that, I am going to turn it over to Dr. Terry Brooks.
Okay, hey, thanks, Jessie. We are so glad to have all of you on today. Whether you are a regular attendee or this is your first ever joining. So my guess is that if you're on this call, you know the vital importance of Kids Count. It's such a cornerstone, not just for folks on this call, but for lawmakers to make policy decisions. As you know, in a lot of ways, when the National Kids Count report is released in June, it stands as this nation's report card on child well-being. We at KYA, I think, look at it in a couple ways. Some of us, not that I'm overly competitive, but some of us look at Kentucky versus other states. So how are we doing compared to Indiana or West Virginia or Tennessee, depending on what your zip code is? But I find it perhaps even more important to think about what we're doing on a longitudinal basis when we think about Kentucky versus Kentucky. I don't want to bury the lead that Amy Swan is going to talk to you about, but this year is a little bit unique because we really are going to pay attention to two sets of data. The summative data was really pre-pandemic. And I don't want to discount that because that did give us trajectories and trend lines. And I want everyone to pay attention to that. The other data that Amy, I assume, is going to talk about is the pulse, household pulse data, which is out of the Census Bureau and is much more contemporary, relevant, and current, and captures where are we in the midst of pandemic world. So there's two sets of data. Let me just editorialize my two takeaways. And I've been told that's all I can say, so then I'll turn it on over. But I have two takeaways that I want you to be thinking about. One is there are consequences of data in the future. And I'm going to give you the one that caught my attention this time around. For the last several years, most of our indicators have shown improvement. We may not be where we want to be, but it's improvement. One data point that has been persistently in the category of getting worse is the percentage of children involved in the preschool experiences. So that percentage of participation has been going down. Well, lo and behold, this year's data reflects a getting worse in fourth grade reading proficiency. For a long time, what we said was there were way too many fourth graders who couldn't meet minimal national proficiency standards. But we were going in the right direction. We now are going in the wrong direction. And while you never want to draw a straight line comparison and correlation, I just want to raise that up is it makes you wonder, doesn't it? If after several years of that decline on how 4-year-olds are doing, that by the time they become fourth graders, it's caught up with us. So one thing that I want all of us to do is to look for that proverbial canary in the coal mine data point, that if there's problems in preschool today, there's going to be problems in elementary school in 4 years. So I want you to think hard about those correlates. The flip side of that is I'm not sure if there has ever been more immediate policy opportunities on which we need you to act than this report suggests. That's at the federal and that's at the state level. And I'm assuming that my very thoughtful colleagues are going to talk about those. But I want to just lift one up because I think that to me, maybe the seminal opportunity is around the child tax credit. We know that as part of the whole pandemic response, that the child tax credit was expanded and flexed up. I can't emphasize the power of that one measure. It affects 93% of Kentucky's kids, over 1 million kids. That one idea, that one commitment alone has the potential to raise 143,000 Kentucky kids out of poverty. 143,000. That's all good news. There is a bad news caveat, and that is that what was approved was for 1 year. Our job, your job, all of our jobs is to make sure that your congressman and both senators hear that Kentucky's kids cannot afford a one-off. We've got to make it permanent. We've got to make it sustainable. In some ways, in fact, if it becomes a one-off, it's kind of a cruel joke. I mean, we will have lifted 143,000 kids out of poverty. And in 12 months, we're going to say, hey, hope you enjoyed it. Now back to normal. So we can't afford to let that happen. And let me just add on just that one policy. The other opportunity is to talk to your state senator and your state representative and say to them, hey, this bipartisan idea, not Democrat, not Republican, not liberal, not conservative, not rural, not urban, this common ground idea in Washington, how about baking that in the Kentucky budget? Let's accelerate that idea. Let's deepen that idea. If the DC idea lifts 143,000 kids out, wonder how many more kids would be lifted out even to a better place if we had a state version of that. Now, that's just one example. So that's my focus. If I were to say the big policy takeaway, man, I am really paying attention to that one. My hope for each of you, because I want to be realistic, you probably cannot leave this Zoomcast with 17 requests. I'd like for you to, but that's probably unrealistic. What I hope you do is listen to Amy's data presentation and my colleagues' policy presentations and pick a couple ideas. It may be the child tax credit resonates with you. Maybe you're going to be more drawn to food security issues or trauma-informed care support ideas, all of which are absolutely essential. So listen to ideas, decide which one touches both your head and your heart. And then I have a feeling that at the end of this call and or in related material, you are going to get sort of here's how to take action. So I want to emphasize to you that the bulk of today is kind of talk at you, and it probably is pretty deep, data rich, and may not be confused with a sitcom. Okay, so it's probably a pretty intellectually rigorous discussion. That's really important. But folks, if you don't act on what you hear today, we have all just wasted 60 minutes. So the whole purpose of today's Zoom call is to set you up to respond as a voice for kids with an actionable ask. That's your homework. I know it's summer, but we're all in summer school. So everybody's going to have homework at the end of this Zoom call, and you're going to have plenty to choose from. It's not KYA or me that's counting on it. It's Kentucky's kids counting on you to take this data and make it actionable for elected leaders, whether they're in Frankfurt or Washington. So thanks for being with us today. Make sure that we actually do ensure that kids count. Ms. Swan, take it away.
Yeah, so this is the 32nd edition of the Annie Casey Foundation's National Kids Count Data Book. And it describes how children across the United States were faring before and during the pandemic, alongside data that hints at the pace of our recovery. And as Terry mentioned, there are really two sets of data that we're going to be discussing today. One is that annual longstanding Kids Count Index of Child Wellbeing. That's made up of 16 key indicators across 4 domains of child well-being, and the Casey Foundation uses that to rank each state on overall child well-being and for each of those 4 domains. And as Terry said, the latest data for this index is from 2019, pre-pandemic. They're comparing that data to a baseline of 2010. And so because we know that a whole lot has happened since 2010, it's really important for us to figure out how kids and families have been impacted by this pandemic, this once in a century event. We're also looking at, as Terry said, the U.S. Census Bureau's Household Pulse Survey. And the Pulse Survey is really the only source of robust national and state data related to the pandemic. The Census Bureau was able to get this experimental survey up and running pretty quickly. So it actually began surveying households across the nation in April 2020. It's still ongoing, and we have reason to believe they'll keep it going through at least the end of this year. And the book compares 2020, which obviously April through December, to the results that came out covering March of 2021. For the second year in a row, Kentucky ranks 37th in the nation for overall child well-being. And here we're looking at the economic well-being domain that's in the book for Kentucky. And so you see that we rank 40th in the US based on these 4 indicators. And I'm going to talk about those in just a second. But I want to first back up and say that this is a really good example, this data, of how even if your state is making progress on all 4 indicators in the domain that the Casey Foundation looks at, you can still have a very low ranking among states. And that's the case here. Only 10 states are doing worse than us in this domain. And that's simply because other states are obviously making progress at a faster rate than we have been. So though each of these indicators improved between 2010 and 2019, the 2019 data shows that we still have more than 1 in every 5 children living in poverty. And for some context, because a lot of times people are shocked at kind of just how little money our federal poverty level is. In 2019, poverty for a family of 2 adults and 2 kids meant an annual income below just about $26,000. So we've got, like I said, 1 in every 5, actually more than 1 in every 5 in poverty. We also have almost 1/3 of all children and families having no parent with full-time year-round employment, though parents may certainly be working multiple part-time or seasonal jobs. We also have nearly 1/4 of children in homes that are having to spend more than 30% of their pre-tax monthly income on housing costs. So that could be rent and mortgage as well as associated utilities. And that 30% or more of income going towards housing is considered by HUD to be burdensome and unsustainable. And then some good news is that we have less than 10% of teens ages 16 to 19 who are neither in school or working. This is a situation commonly referred to as disconnected youth or opportunity youth for the more strengths-based view of it. There are some highlights that you're not going to find in the data book that I wanted to share with you, including the fact that Kentucky is in the bottom 10 states for children living in poverty and for children in families in which no parent has that full-time year-round employment. But we have a lower, meaning better rate than the South as a whole and the nation for children living in households with a high housing cost burden. I want to talk about some racial disparities that we've seen in the data. So Black and Hispanic communities have faced historical and ongoing discrimination in housing, employment, and financial services. And we know that this discrimination has compounded across generations. It's resulted in many families having less wealth and assets and being more racially and economically segregated. And as a result of that, we see substantially higher child poverty rates for Black, Latinx, and multiracial children compared to their non-Hispanic white peers. So for example, child poverty rate in 2019 for Kentucky for multiracial children was 33%, 1/3 of all multiracial children. It was 32% for Black children and 30% for Latinx children. And that's compared to a rate of 19% for their non-Hispanic white peers. Now, some good news on the race equity front is that in Kentucky, Black teens were half as likely at 4% as white teens were at 8% to be disconnected from both school and employment. But we need to keep our eye on this because this has not been a consistent trend over the years. Hopefully it is the start, though, of a positive trend. In education, Kentucky now ranks 30th. While the state saw slight improvement between 2009 and 2019 in the percent of 8th graders proficient in math, we still have close to 3/4 not proficient in that subject area. We also have a majority, 65% of 4th graders not proficient in reading. And these proficiency scores, I should point out, are from the National Assessment of Educational Progress, which has a higher standard than the K-Prep testing that's used by Kentucky. So just to clear up any confusion there. I think a lot of advocates would argue that the National Assessment of Educational Progress is more of a gold standard for testing proficiency, and that it's therefore really important to pay close attention to these scores, maybe even more so than the K-Prep ones. Kentucky's doing very well on high schoolers graduating within 4 years of entering high school, with only 9% not graduating on time. But we, have to think about, are we graduating students insufficiently prepared if we have such poor proficiency scores? As Terry mentioned, we are moving in the wrong direction on getting young children enrolled in public and private preschool and kindergarten programs, with 6 in every 10 3 to 4-year-olds not participating in such schooling. Kentucky's in the bottom 10 states for children ages 3 to 4 not attending one of those preschool program types. We also have only 2 states that have a lower rate of high school students not graduating on time. So again, we're actually setting the bar nationally in a positive way for that. But I want to point out that this success should not overshadow persistent racial disparities that we must address. So, for example, high school graduation rates for Black students in Kentucky were 17% not graduating on time. Latinx students, 16% not graduating on time, compared to non-Hispanic whites at 8%. So you'll see that the not graduating on time, which is a weird way to word it, but those rates were, for Black and Latinx students, were double what they were for their white peers. Kentucky's, it's probably an editorial, but what I would say are contemptible outcomes in reading and math proficiency are hitting Black and Latinx students the hardest. So while all racial and ethnic groups have pretty dismal rates, at least 3 in every 4 Black and Latinx students have not achieved proficiency in those subjects, according to that 2019 National Assessment of Educational Progress. So clearly, the status quo has not been working, and I would argue calls for an education revolution. Kentucky now ranks 35th in health, And with the exception of childhood obesity, which has remained at 37% over the past few years, the other key indicators have improved since 2010. The greatest gains have been in children having health insurance. So we now have only 4% of children uninsured in Kentucky. Again, that was pre-pandemic. Also notable, Kentucky saw a slight improvement in its rate of low weight births, while the national average slightly worsened. Kentucky is in the bottom 5 states for children and teens who are overweight or obese. And though body mass index is not always a perfect measure of whether someone is overweight, according to the National Survey of Children's Health, only 2 states had higher rates than Kentucky. Again, this is for youth ages 10 to 17, and it's defined as having a body mass index at or above the 85th percentile. I mentioned that the rate of children without health insurance has significantly improved. It fell by 43% from 2010 to 2019. That can largely be attributed to expansions of public coverage and Affordable Care Act provisions to make health coverage more affordable for adults. We know the research shows that children are more likely to be covered when their parents are. However, where we now need to focus our efforts is on enrolling Latinx children in coverage, as their uninsured rate is more than double that of their non-Hispanic peers. Also of note, while the majority of child and teen deaths were preventable, i.e. injury related, the proportion of injury-related deaths due to a violent cause of death have been increasing over the years. In 2019, there were 39 youth who died of suicide and 39 youth who died due to homicide. I'm sure any child advocate would argue one death is one too many, and so we certainly need to take steps to address violence and mental health concerns. The death rate for Black youth was 55 per 100,000 ages 1 to 19. That was almost double the white rate of 26 per 100,000. And unfortunately, we do not have detailed enough data disaggregated by race to kind of get at the causes of that disparity, but it's something that we certainly want to look into. Lastly, Kentucky ranks 43rd for family and community context. This is a very low ranking, despite, as you can see, 3 of the 4 indicators moving in the right direction. Again, an indication that other states are progressing faster. Kentucky had a statistically insignificant increase from 35 to 36% in children living in single-parent families, but the teen birth rate fell by 46% between 2010 and 2019. And I want to point out that though there is nothing inherently negative about single-parent families, Kids Count tracks that measure because children growing up in single-parent families typically have access to fewer economic resources and valuable time with adults than children in 2-parent families in which child-raising responsibilities can be shared. 11% of kids were living in families where the head of household makes a high school diploma. That's actually a slightly better rate than the national average, which is great. However, Kentucky has a high rate at 15% of children living in areas of concentrated poverty. And what that is, the operationalized definition of that is children living in census tracts or, quote, neighborhoods where 30% or more of all residents were living in poverty. Only 3 states have higher rates of children living in areas of concentrated poverty than Kentucky. Also, only 5 states have higher teen birth rates than Kentucky. There are both historic and current contributing factors to the racial and ethnic disparities among children living in high poverty areas. This ranges from past redlining practices, discriminatory financial institutions, and present-day zoning, development, and transportation plans, among a number of other structural and systemic barriers. To give you an example of the disparities that we see in this, the rate for Black children in Kentucky was 32%, so almost 1 in every 3 living in a high poverty area. For Latinx children, it was 20%, 1 in every 5. multiracial children, 19%, compared to 12% for non-Hispanic white children. As we wrap up, I wanted to share that household pulse survey data for Kentucky that Terry mentioned. While the survey collects much more info from households, we're going to focus here on just 4 indicators that have particular relevance to child and family well-being. As you can see, the good news is that the numbers are moving in the right direction as pandemic recovery efforts start to ramp up. Though we would certainly argue that the March 2021 results show that we as a nation and as a state still have much to do to ensure families have their basic needs met and to address the widespread impacts that we know have happened on individual and families' mental health, which in turn can place families at increased risk of substance abuse and child maltreatment. And Kentucky already has had for 3 consecutive years the highest rate in the nation of child victims of abuse and neglect. So from 2020 to March of 2021, the percent of adults living with a minor child who said they felt down, depressed, or hopeless fell from 26% to 22%. The percent of adults living with children in which the adults lacked health insurance fell from 8% to 5%. I think this is an example of how an administrative response during a crisis, such as reopening and promoting Medicaid enrollment, can certainly address the ripple effects of a surge in unemployment. The percent of households with children who sometimes or often did not have enough food to eat has slightly improved from 15% to 13%. And the percent of households with children who had little to no confidence in their ability to pay next month's rent or mortgage payment has decreased from 20% to 15%. I'm now going to pass the mic to KWA's policy team. They're going to share a handful of recommendations on what can be done to ensure Kentucky gets better marks on this Kids Count report card in the next 5, 10, and 20 years from now. Mehek, I'm going to point it over to you.
All right. Hi, everyone. Mehek Kaur here with Kentucky Youth Advocates. So what Amy just showed us is the data sets. What the data sets just showed us and Amy just discussed is we still need continuous, bold action that prioritizes equitable solutions. The pandemic isn't over, and the choices ahead will determine whether recovery can really be sustained. So in a few moments, you'll hear from my colleagues talking about state and federal solutions as child advocates that you could take on by sector and issue arena. So I'm going to first start talking about reducing child poverty. Among the provisions in the Federal American Rescue Plan of 2021 which provided pandemic relief, is an expanded version of a child tax credit. As Terry alluded to, approximately 1.1 Kentucky children and their families will be eligible for a 1-year expanded tax credit. And this includes low-income families who have not historically made enough or had enough income that will be eligible. And this tax credit, expanded tax credit, will truly be a game changer for millions of children, as it's a way to help families with the basics, something that we know that they need, especially at this moment. The expanded tax credit program will begin starting July 15th, and families with children can anticipate receiving checks from the IRS at that point. So for every child ages 0 to 5, families can receive up to $300 a month, which is a total credit of $3,600. And for every child ages 6 to 17 living in a household, families can receive $250 a month, which is a total of $3,000. And families do not need any earnings to qualify. So as policymakers begin to thinking about investments for children, families, and communities, we must ensure equitable and expansion recovery includes prioritizing communities of color hardest hit with the pandemic. So one step is Congress should make the expansion of the child tax credit permanent. We know this is a bipartisan policy, so lawmakers should find this common sense to ensure the largest ever anticipated 1-year drop in child poverty is not followed by a surge. Additionally, Kentucky lawmakers can build upon that effort by enacting a state-level refundable earned income tax credit. This is an initiative that is a proven track record of helping families meet the basic needs of their children. It also reduces reliance on government supports and improving child well-being as well. Both of these efforts are critical in eliminating structural inequities in the tax code, especially as more than half of the Black children have historically been ineligible for a full child tax credit because their household incomes were too low, while only 23% of white children face this barrier. So now I'm going to turn it over to Patricia to talk about access to high quality childcare.
Hi, everyone. So I'm going to talk about one solution, notably, Terry mentioned it and then Amy followed up, that our Kids Count data shows that Kentucky is moving in the wrong direction on 3 and 4-year-olds enrolled in school. And we know that many children, if they're lucky in Kentucky, are able to attend preschool through a licensed child care center. And that has the benefit of it helps them get ready for kindergarten. We know there's data that shows that the benefits there, but it also allows their parents to work. And we know, all of us, that pandemic has truly shown that without childcare, our families, our communities, and the economy cannot successfully function. It truly is basic infrastructure, but one that has seen very little public investment, and that's been laid bare by this pandemic. Pre-pandemic, 50% of Kentuckians lived in a childcare desert, which means they had limited to no access to licensed childcare. We also know that many parents, particularly mothers, left the workforce due to lack of childcare options. And many times affordability of childcare options, of course, impacts that decision. So this limited infrastructure that we had was greatly threatened by the pandemic as childcare providers struggled to keep their businesses afloat. Fortunately, with the help of many of you today on this call and advocates statewide, childcare was included in all 3 relief packages that were passed by Congress, most recently with the American Rescue Plan. And we're really grateful to Senator Mitch McConnell, Chairman Yarmouth, and our other representatives in DC for championing childcare. And again, to many of you who helped advocate and make that happen. In addition, state legislators included funding in the most recent state budget to increase reimbursement rates for providers who participate in the Child Care Assistance Program, which is critical to ensure access to care for low-income children. So the good news is this $2 a day per child increase goes into effect next Thursday, and it's a step in the right direction. But as the unfortunate news is that we were already pretty bad off beforehand. So looking ahead, Kentucky needs to use these federal funds to not only continue to stabilize the childcare sector, but to use this as an opportunity to reimagine and move toward a better system that truly meets the needs of children, parents, and employers. And so from our perspective, this must include measures to increase the compensation of early care educators, especially as women of color make up a large percentage of the early childhood workforce, and they are shouldering the weight of this underinvestment. We also need to rethink how we pay our providers. We should be thinking more about basing the rates that we reimburse them on the cost of providing care, and continue to pay based on enrollment rather than attendance, which can help them sustain their businesses. And we also need to continue to increase the eligibility level for child care assistance and reduce or even ideally eliminate copays for our most low-income parents so that more Kentucky families can access this much needed support. And so the bottom line is that the status quo for childcare pre-pandemic was completely insufficient. And so, you know, we have this opportunity at hand now with federal funds. We need to continue to increase state funding, and we need to rethink the way that we fund childcare, support childcare, and build it back better so that it truly works for everyone in Kentucky. And now I'm going to turn it over to my colleague, Kesh Price, to talk about school-based mental health supports.
Thank you, Patricia. Good morning, everyone. We really need to think about the fact that we have all picked up and carried on through dual pandemics. However, we have to address the fact that our kids, our families, our educators, administrators are all carrying a lot of trauma, a lot of things that haven't been processed or unpacked yet. And so when they come to school in August, ready to learn, and I'm saying that in air quotes, ready to learn, we really have to think about what measures need to be in place to ensure that they're actually ready to learn, that they have the supports so that they are mentally available to process and take in new information. That Kentucky can build upon the School Safety and Resilience Act of 2019 by using American Rescue Plan dollars allocated for K-12 schools as a seed investment to hire school-based health providers to ensure that that ratio of 1 to 250 students, one school-based mental health provider to 250 students is adhered to, and that's the recommendation from the American School Counselors Association. We are far from that in many of our school districts, and to be honest, if we are talking about this in an equitable fashion, we wouldn't be talking about 1 to 250 for every school district. There would be an emphasis to ensure that the schools that needed more support were able to get that support based on many of the factors that we've talked about within this report. Family income level, race-based trauma that may be experienced at the schools, students with special needs, a lot of factors that are LGBTQ plus population. So if we are thinking about how these funds are going to be utilized, we really need to talk about that strategic implementation and carry out of the School Safety and Resilience Act. And if you remember or recall, there's also an element around school resource officers within that act. So to emphasize more of the mental health supports and to diminish the policing of schools is key priority. $123 billion was allocated for K-12 schools in the American Rescue Plan. And KDE, the Kentucky Department of Education, will receive over $3.2 billion in funding through the Elementary and Secondary Emergency Education Relief, which is the ESSER fund, the majority of which has already been received. And each school district has to submit their plan on how they plan on allocating those ESSER funds by July 31st, and they are required to receive community feedback. So one of the recommendations is for people to weigh in on that. That's not a lot of time, and while everybody is enjoying the break, we have to start thinking about preparing a better environment for our kids when they return. And I am going to take a moment just to drill down on the fact that our kids did not have what they needed pre-pandemic, right? We know this. And to pretend that we're just going to carry on and not address these issues, it's criminal. So we have to make sure that we are holding people to the reality of where we are, where we've been, and where we need to go. I am going to now pass it over to Alicia to talk about child feeding programs.
Thanks, Kish. So I'm Alicia Watley with KYA. And as Amy shared earlier during the data presentation, we know that food security really was a concern for many Kentuckians before the pandemic, and it continued to be a major stressor over the last year as many households with children were reporting sometimes or often not having enough food to eat. We also know that there were programs that were successful during the pandemic in mitigating these issues, such as the pandemic EBT program, which was able to connect students and their families with the critical grocery money that they needed while their students were really learning virtually throughout the pandemic. So we really need to be building on the success of that program. And one way to do that is through the summer EBT program. And this has been approved temporarily through the American Rescue Plan for this summer, the summer of 2021, but it should really be made permanent. And this is just another opportunity for eligible students to receive the same kind of grocery money that they would during the school year on that EBT card in the summer when they're not in school as well, because we know they still need access to healthy meals during the summer. And also we know that in pilots of that summer EBT program around the country, child hunger was reduced by up to 30% in areas that implemented those pilots. So right now, Congress has the opportunity to act on several pieces of federal legislation that would ensure kids aren't hungry during the summer. So one of those is the Hunger Free Summer for Kids Act, and that's actually co-sponsored by Senator McConnell. In addition, there are a lot of efforts going on right now around the Child Nutrition Reauthorization, which is a larger package that would include several child feeding programs and also address that summer EBT option. And then we also know that through the American Families Plan, there are proposals in place for that as well. In addition, as children are transitioning back to in-person learning this fall, we know that our Kentucky elected leaders have an opportunity to really enact a policy that would allow students a short amount of their instructional time at the beginning of the school day to eat breakfast in their classroom. And this is a change that would really boost efforts to ensure children can concentrate and make sure that they are able to learn during the school day and are not hungry. So those are just a few opportunities for nutrition assistance for families and children, both during the summer and during the school year. And with that, I would think I'll pass it back to Mehek to talk a little bit more about paid family leave.
Thanks, Alicia. So a robust body of research demonstrates that access to paid family leave contributes to a stronger health outcomes for children and parents, also increases financial family stability, and it's a greater economic equity. Positive impacts associated with paid family leave include fewer low birth babies, fewer infant deaths, higher rates of breastfeeding, as well as long-term achievement and fewer behavioral challenges for kids. For parents, it contributes to a longer lifespan and improved mental health, as well as a greater income consistency for families, and relief from compounding effects of racial disparities and access to wealth and quality health care. For our employers, it boosts employee morale, productivity, and contributes to greater work satisfaction, and also reduces turnover. So Kentucky should allow state employees to access 12 weeks of paid family leave after the birth or adoption of a child. And this is the first step that a measure could take that could provide us really a model. This can be a model for the private sector, really. This would allow families to be there for the important first steps of their children's lives while currently knowing their employment is secure. Currently, Black and Hispanic workers are less likely to have access to paid family leave than their white workers. And also, improving access to paid family leave would boost family and economic stabilities for all eligible families. And now I'm going to turn it over to Shannon.
Thanks, Mehek. So I'm going to focus on the child welfare continuum, but two items in particular, child abuse prevention and youth aging out of care. As my colleagues have discussed, our parents dealing with a dual pandemic saw a lot of stress over the last year, and a lack of adequate childcare, a lack of unstable employment, and the stress that exacerbated already, present mental health issues and substance use issues created a lot of issues for our parents and caregivers across the state of Kentucky. What we saw was over 1 in 4, or 26% of Kentucky adults living in households with children felt down, depressed, or hopeless in 2020, with only a slight improvement of 22% by March of 2021. And what we saw in response to the stressors that were brought on to parents or to parents and caregivers that the federal government prioritized was the American Rescue Plan Act allocated $150 million to states for the maternal, infant, early childhood home visiting program. And typically in Kentucky, we see that as the HANDS program, as our voluntary home visiting program. We also saw an increase in funding for the CBCAP, or the Community-Based Child Abuse Prevention program, which DCBS can use to promote access to and create supportive environments for parents and caregivers, including parent resources, support programs, coordination of or referral to substance use treatment and intimate partner violence services. We also saw the American Rescue Plan Act include $350 million in emergency funding through the Child Abuse Prevention and Treatment Act, or CAPTA, $100 million of which can be used for recruitment and retention of caseworkers, interagency communication and processing, investigating child abuse and neglect reports. So I think we in Kentucky have an opportunity to continue working to create access to more primary prevention supports like home visiting programs, and create additional supports for parents struggling before they even come to the attention of DCBS. I hope to see the Department for Community-Based Services also work to retain our high-quality workers by reducing caseloads and creating more efficiencies in the system with those federal dollars. What we also saw young people especially be impacted by the pandemic with the loss of jobs, loss of kind of normalcy in their lives, accessing education, and losing employment. And what we saw, the federal government's response to that, especially for youth aging out of foster care, they included an additional $400 million through the Chafee funds, which $50 million of which reserved for the education and training vouchers. They increased the eligibility for access to that assistance to the age of 27 through 2021. And they waived the post-secondary education or training program requirement if a young person was unable to complete it due to COVID-19. It also prohibited states from requiring a young person to leave foster care solely due to their age, and allowed young people to re-enter care during COVID-19. And all of this is in effect until October 1st of 2021. Kentucky take this opportunity to really revamp the way that we serve young people and those transitioning from care by ensuring our foster care alumni are part of the decision-making process and are provided opportunities to help spread the word about accessible supports, utilizing those young people to talk to other young people who are in similar situations to make sure that they're accessing those supports, and then also ensuring that there is a warm handoff to services as young people transition from residential care to independent living, or from foster care to post-secondary education. So we are looking for we should prioritize and expand primary prevention and family preservation programming, accessing those federal funds, and on the state level, seeing an increased investment in family preservation programming and strong safety net supports for young people transitioning from care. With that, I will transition to my colleague, Carly Mosby-Smith.
Thanks, Shannon. And thanks again to the folks on the call that presented today. Thanks to Amy for providing us with, a kids count data download specific to Kentucky, and just for the rest of the team for sharing those tangible solutions that can help address the challenges that kids and families in Kentucky face, and those challenges that we see reflected in the Kentucky Kids Count data. We also want to thank Aetna Better Health of Kentucky for their support of today's Advocate Virtual Forum. Looking ahead to some upcoming forums, so next week we'll be discussing updates relating to child nutrition and access to food, including that summer EBT that Alicia talked about, federal investments, outreach to families, and more. So we'll have a representative from the Kentucky Cabinet for Health and Family Services as a panelist, along with Karina Cash from Feeding Kentucky. And then the following week, we will be taking a break after the holiday. So as always, the follow-up email will include a recording of today's forum, along with some of the resources that we've shared and are being shared in the chat, and some of those questions, and a link to sign up for next week's forum as well. So with that, I just want to thank everybody for joining us today, and hope you all have a great rest of your day.